Good to go? All right. Good morning, everyone, and thank you for joining us on a rather wet Friday morning for our COVID-19 briefing. Just to begin, the COVID situation in Atlantic Canada and across the country continues to improve week after week and day after day, with case counts going down and vaccination rates going up. So that's a very good sign for us in Prince Edward Island and our country. Dr. Morrison and her team have been monitoring the situation in Atlantic Canada closely, and by conducting over 25,000 rapid tests at our points of entry over the last 14 days without having a single positive case detected, we now have a level of confidence that the risk of COVID-19 entering our province is lower, but it remains something we need to be mindful of when we look outside of Atlantic Canada. But based on those numbers, and for that reason, Dr. Morrison will shortly be announcing a change in the testing guidelines for our points of entry that will come into effect today at noon. This will include removing the testing for anyone who has a PEI pass and traveling within Atlantic Canada, and focusing our efforts on testing those traveling from outside of Atlantic Canada. So just to be clear, if you're an Atlantic Canadian resident with a PEI pass, entry to Prince Edward Island will look very similar to what it was last year. Like last year, there will be a screening process, but as of today at noon, you will not need to be tested if you have the PEI pass. In addition, effective noon today, there will be an easing of masking restrictions for indoor spaces. Masks will no longer be mandatory in indoor spaces. Instead, we will be asking Islanders to use their discretion on wearing a mask or not, and many factors will go into that. And Dr. Morrison will be providing some further details on what factors should be considered in making the decision to wear a mask or not. And she will be providing some recommendations on just who should wear a mask in the days and weeks ahead. As well, we have opened our PEI pass stream to those outside of Atlantic Canada, and on July 18th, we will begin to welcome tourists and visitors from the rest of the country to our island shores. These milestones are taking place sooner than we had originally planned, and we are able to do this because the medical factors that go into our decision-making process allow us to do so. As I indicated earlier, the national case numbers have declined. The regional case numbers have been minimal. The uptake on vaccinations in Prince Edward Island and across the country has been very strong. And additionally, as I said earlier, that through the efforts of testing at our points of entry into PEI, having tested over 25,000 people without a single positive, all of these things give us an increased level of comfort to make the steps ahead. Again, I would say, as we have often done so here, that we need Islanders to continue to practice caution, that we're not through this entirely as of yet. We feel we're getting closer and closer to normalcy, but vigilance continues to be needed. We need Islanders and all of those coming to our province to continue to make good decisions, not just for themselves, but for others, as we get out and enjoy what we hope and know will be an exciting and wonderful island summer. So with that, I will pass it on to Dr. Morrison for her daily briefing.
Thank you, Premier. Good morning, everyone. I think each of these briefings more recently have been hopeful and positive, and this is another one as we take steps towards getting out of this pandemic. As normal, we'll talk about the situation in PEI in Canada, a little bit about vaccine and the changes the Premier mentioned in terms of testing strategy and the easing of mask requirements. There are no new cases of COVID-19 to report today. We've had a total of 208 cases since the pandemic began, and we currently have one active case. There have been 43 new cases in Atlantic Canada during the past week. In the rest of the country, new cases were down a further 20%, with an average of 478 new cases reported each day, and that's a rate similar to what we experienced in the country in late August of last year. We are doing better than projected by the national modeling, which really gave similar numbers that we would see by the middle of July. There are less than 6,000 active cases in the country, again, the lowest active case count since late August. All these numbers are heading in the right direction and tell us the vaccines are doing their job effectively and that public health measures are working. We do continue to watch with interest the increased number of cases in Europe and Africa and the variants of concern. We hope to avoid a fourth wave in Canada and in PEI by fully vaccinating the highest number of people possible. As of Thursday, July 8th, a total of 161,660 doses of vaccine have been administered here. 84.35% of the eligible population has received at least one dose of COVID-19 vaccine, and 30.6%, or 43,065 individuals, have received 2 doses. Based on the supply of vaccine in PEI, we will have enough mRNA vaccine to fully immunize 50% of our population age 12 and up by the end of July. We do continue to get questions pertaining to vaccine, and one is around the recommendation to have 8 weeks between doses, and that's to provide the optimal immunity and protection, although some people with informed consent may be, and for certain reasons, may be having their vaccine less than 8 weeks. Also questions around the mixing of mRNA vaccines, and these vaccines can be interchanged, and that is based on national recommendation. So if you've received Pfizer for your first dose, it is safe and acceptable to receive Mrna for your second dose and vice versa. Individuals who receive 2 doses of mRNA vaccine, one Pfizer and one Mrna, for instance, are considered fully immunized. PEI residents who have not yet scheduled their first dose of vaccine should make an appointment as soon as possible. And note for parents of school children who receive their first dose of vaccine at school, they will be sent appointments for their second dose over the summer. On June 27th, the PEI Pass, really for vaccinated travelers within Atlantic Canada, was implemented, and we started testing at points of entry on that date. So as the Premier mentioned, over 25,000 individuals have been tested using molecular point-of-care rapid tests. Despite this large volume of testing, there have been no confirmed positive cases of COVID-19 at our borders. With each passing day, as we test travelers entering PEI, we gain more evidence about the risk of COVID-19 at our points of entry. The decreasing case counts in the Atlantic provinces and throughout Canada, coupled with our extensive testing data, and of course our increasing vaccine rates, give us a degree of confidence that the risk of importation of COVID-19 into PEI is low. Regarding our lab-based testing resources, for individuals with symptoms, we continue to have excellent capacity and turnaround times. Our rate of COVID-19 testing per capita is 5th in the country. Last week, we completed 18,600 COVID-19 tests in PEI, including lab-based tests, and point-of-care tests at the testing clinics, as well as our points of entry. Like so many aspects of COVID, it's always important to balance the risk of importation of the virus to PEI with the public health and travel measures. Our focus has always been on both the protection of the health of PEI residents and protecting the capacity of our healthcare system. The testing data suggests the risk of importation of COVID-19 is low, and this risk will continue to decrease as more and more travelers and PEI residents receive their second dose of vaccine and become more fully protected against COVID-19. We've stated previously that our testing strategy will evolve and adjust over the summer. Effective at noon today, our point of entry testing strategy will be adjusted to focus on the following groups: individuals from within Atlantic Canada who do not have a PEI pass and are required to self-isolate for 8 days, individuals from outside Atlantic Canada, and people arriving from international destinations. Individuals arriving to the province from within Atlantic Canada who have a PEI pass will not be tested at the points of entry. However, everyone who enters the province will continue to be screened at the points of entry, as they have been since spring of 2020. While our testing strategy is being modified, we will retain the capacity to adjust and refocus our testing efforts if necessary. In the event there is an outbreak or a hotspot in the Atlantic provinces or elsewhere in Canada, we will quickly target our testing strategy to focus on individuals entering PEI from certain destinations. Individuals who are entering PEI, visitors and PEI residents, are asked to be patient at the points of entry and to please be respectful in your interactions with the border screening and testing staff. Thank you to the many people who have been patient and understanding towards the border staff. Many of the staff are young people who have stepped up to provide an important public service, agreeing to work 24/7 shifts outdoors regardless of the weather. Based on emerging international evidence and Canadian guidance, last year at this time, non-medical masks were recommended. And over the summer and early fall, islanders gradually became comfortable wearing non-medical masks in indoor spaces. In November, we moved to requiring individuals to wear non-medical masks in closed indoor settings. PEI delayed making masks mandatory at that time, and we delayed it longer than many other provinces in recognition that masks provide another layer of protection against COVID-19, but do not replace other public health measures. PEI residents responded positively and swiftly to the requirement to wear masks to protect themselves and others. And really, there was a marked increase in the number of people wearing masks in closed indoor spaces very quickly. Last week, we announced it is no longer required for individuals to wear masks while seated at indoor events such as concerts and worship services, provided there's physical distancing between members of different households. As the Premier mentioned, effective immediately, there is further easing of mask requirements in PEI. Non-medical masks are no longer required, but they will continue to be encouraged in indoor settings for individuals aged 12 and older based on a number of factors, on vaccine status, your personal health status, who you may be with, the setting you're in, and the space that you share with others. Masks will be optional for children aged 2 to 11. Masks should not be worn by children under the age of 2. Masks do remain an important layer of protection when we are around people who we do not know or who may not be fully protected against COVID-19. And sort of to mention it again, you need to consider a number of factors when deciding to wear a mask or not. Are others fully protected around you? Are you immunocompromised? What is your own health status? And what is the health status of those around you? What kind of setting? Are you in a crowded elevator, or are you in a setting where you have a lot of space between you and others? Whether you have an ability to maintain that physical distancing. And importantly, your own comfort level. Fully vaccinated individuals, including those who are immunocompromised or at risk of severe outcomes related to COVID-19, may choose to continue wearing a mask in indoor spaces to provide them with an additional layer of protection. Businesses and organizations providing in-person service to the public where physical distancing cannot be maintained, restaurant staff, retail and grocery staff, hairstylists and barbers should continue having staff and service providers wear masks, given that they do not know the vaccine status of their customers or patrons. Businesses and organizations can choose to follow their own policies and guidelines that may be more strict than provincial guidance regarding the wearing of non-medical masks. And service providers and organizations do not need to ask for proof of vaccine status from patrons who are not wearing a mask. For the purposes of wearing a mask in indoor spaces or not wearing a mask, vaccine status is based on the honor system. Healthcare facilities and providers, public and private, should continue with their masking policies until at least 80% of eligible island residents are fully vaccinated. For greater clarity, this announcement does not change the mask requirements for staff, visitors, and partners in care in long-term care facilities. And masks continue to be required for individuals who have specific travel-related self-isolation exemptions, such as work isolators or compassionate travelers. Moving from mandatory masks to a situation where masks are recommended and optional, discretionary really, will not be easy for some people. And in fact, some who I've spoken to will say they may be fully vaccinated, but they said, well, I will certainly still continue to wear a mask into a grocery store, for instance. And that is a personal choice. It's important that during the next few weeks and months that each one of us find our comfort zone and our own pace in relation to masks. Until there are more people fully vaccinated, we continue to talk about the importance of wearing a mask, and we will all have to decide what is best for ourselves and others. So to restate it, masks are no longer mandatory in closed indoor spaces in PEI. However, as we've outlined, there's certain situations that I would continue to encourage Islanders to wear their masks, and that is really based on the vaccine, if they're fully vaccinated or not, the setting they're in, and their health status. No proof of vaccine will be required, and businesses and organizations may follow their own policies and guidelines. And masking requirements for healthcare facilities and providers will remain unchanged. Masks provide that additional layer of protection and do not replace other public health measures, including physical distancing and hand washing. And as we navigate through the coming weeks, it's important we continue to be understanding towards ourselves and respectful of the decisions made by others, including individuals, businesses, and organizations. I've had a number of people ask me, what will the remainder of the summer be like? And here's a few things about the next couple of weeks. We'll continue to immunize island residents as quickly as we receive vaccine. We know that 1 dose plus 21 days provides good protection, but 2 doses of vaccine provides more sustained protection. Physical distancing will continue to be an important public health measure until we achieve that broader herd protection or broader protection amongst the population. Physical distancing matters, and island residents really should avoid being in large crowds of people they do not know when they're really close together. People who are immunocompromised and individuals who cannot be vaccinated should be extra diligent in avoiding crowded spaces and maintaining physical distancing. And being at outdoor events is safer than being at indoor events. Frequent hand washing and staying home when not feeling well will be with us for the foreseeable future. And I do think life will be different for all of us when we achieve our target of having at least 80% of PI residents immunized with 2 doses of vaccine. On July 18th, which is really the end of next week, we will begin welcoming family, friends, and visitors from outside Atlantic Canada, outside of any established travel stream. So those who are fully vaccinated and have a PEI pass will not have to self-isolate. Those who are partially vaccinated or not vaccinated will be required to isolate for 8 days. Also on July 18th, the personal gathering limits will change and will go up to including 50 people, and there will be no limit on the number of people seated at tables in restaurants. Also on July 18th, organized gathering limits will increase to 200 people outdoors and 100 people indoors, and multiple cohorts are permitted based on approved operational plans. And up to 200 people can attend weddings and funerals. As I said in the beginning, these are very positive steps and announcements, and it indicates that we continue to ease out of COVID-19 and resume more normal activities and interactions. For months, I think we've been waiting for the day where we could begin talking about easing masks, travel restrictions, and taking steps to demonstrate that we really are getting through this. And I know the sentiments of the public health team that are shared by many island residents is that we're realizing sometimes it's more challenging to ease out of restrictions than when they came in and started being imposed. And this is probably more so in our province because we've navigated through this global pandemic so successfully, really with limited impacts and no deaths. We're always aiming to strike that right balance. However, as we've discussed previously, there's no playbook to guide all the pandemic-related decisions. So as we continue our journey, and I think it is getting closer to the end through COVID-19, let us continue to be patient and continue to be kind. Thank you.
Thank you, Dr. Morrison. Appreciate that update. And now we will turn it over to some questions from our friends in the media.
Dave Stewart, The Guardian.
Good morning, Premier King and Dr. Morrison. Just want to clarify, Dr. Morrison, I think I understand you correctly on the lifting or the easing of restrictions for restaurants. For example, a story I did yesterday, New Glasgow Lobster Suppers, they had their capacity capped at 250, which is 50%. Do I understand correctly that restaurants can now go to full capacity? Did I understand that right?
Hi, Dave. So it wasn't. We weren't speaking about capacity of restaurants. It's right now. The seating number of people at a table is up to 20, but that is really the table size. So it's not about the changes in terms of the cohorts. And I think the New Glasgow Lobster Supper number is based on the cohorts within the restaurant and how many tables they're able to set up, maintaining distancing between the tables.
Gotcha. Okay. Follow-up question, I guess, would be just in reference to the stats that I looked at on second doses. I think it's on your website, and you mentioned that we're at 31%, I believe. But if I'm reading the charts right online, we're 10% below the rest of the country. Any concerns there?
So I think all those numbers right across the country, when you look at the combination of first doses and second doses, really there's very little statistical significance in terms of the amount of vaccine that's been administered across the country. So we actually have a fairly high rate of first doses of vaccine, which I think is excellent, with 84% of our eligible population having one dose. And now we're really, I know every week right now, the number of people getting their second doses is going to continue to jump fairly dramatically. I know the Premier and I both had a chance to get our second doses yesterday, so it seemed to go by very quickly. And I think the other part is that there are some people who are getting their vaccine in other places less than 8 weeks apart, and for some, that is certainly happening here with informed consent, but we have enough vaccine that there's a certain amount that comes in every week. But if people can wait 8 weeks in between the two doses, that is certainly best in terms of providing the best kind of protection, immunity, longer term as we go into the fall and winter.
You said you both got your second doses. How did you feel afterwards? Because some people comment that second dose can be a bit rough.
I can let the Premier answer for himself too, but I think we both had a bit of a stiff arm, but I think otherwise feel fine.
Yeah, I had a stiff arm. I actually went home and put in 3 wagon loads of hay, so that probably made my arm a little stiffer than... And I was a little bit irritable, David, but that had probably more to do with the hockey game from the night before. So other than that, I feel fine.
This is on the last. Thank you very much.
Brian Higgins, CBC.
Yes, hi, Dr. Morrison and Premier King. I'm sure everybody will have a million questions about the details of where and when they should wear a mask. So just to be clear, it is now discretionary. It's no longer a public health order. private businesses can exceed the minimal requirements. And were you saying it is at the discretion of people like haircutters and whatnot? And really, I'm wondering, what are those criteria that people should use to decide if they should wear a mask in a indoor setting or not?
Hi, Brian. I mean, I think you captured it well as you laid it out there. But I think in terms of, as the public health officer, certainly it is a recommendation that you would wear a mask until you are fully protected with a vaccine. And so that's one of the criteria, but it is not mandatory. It is, we're taking that order away, but island residents have made really good decisions all the way along, and they've worn masks to protect themselves and others really over the period of last summer and then even when it was mandatory. And I think many will continue to do that until they're fully protected. Many will continue to wear a mask when they have health conditions. They may be immunocompromised. People who are fully vaccinated may continue to wear a mask in certain settings because they are more comfortable doing that. So it is really moving away from some population-level decisions to more personal risk, decisions around personal risk. And that's a hard transition in many ways, but I think it's an important one as we move forward in this pandemic.
And I just add that, Brian, that I mean, Dr. Morrison and I have talked extensively about this very issue for the last couple of weeks, and I mean, it's hard not to look at the evidence of the last 17 months in terms of not just masking, but all of the public health measures that we have been following have helped limit the spread of not just COVID in this province, but of influenza, of cold, and overall, from the perspective of Dr. Morrison as the Chief Public Health Officer, that makes Islanders healthier, and that is a really good thing. I think if you look back to last summer, where we were, that's similar to what the regulation is now, where that we didn't require a mandatory mask, but many businesses and organizations made decisions based on their staff and their customers to do so, and I expect that's where it will be again. And I think, quite personally, that I think the masks have given us all a level of comfort for ourselves and to help protect others, and I don't expect they will disappear quickly, and nor should they. I think you should still have a mask in your car or on in your pocket or in your purse or wherever, because I think that there'll still be a public expectation by many that until we're really through this to be mindful of others and how quickly this disease can be spread. So I think we're trying to go back to where we were last year to a certain degree. But we realize these steps will require caution, and it will take some longer than others to make them.
That kind of feeds into my next question. Is this an occasion for celebration for Islanders, or is this an occasion for caution?
I think both. I'll let Dr. Morrison answer this question in more detail than me, but I think it's a little bit of both. I think on the surface it's an important, another important milestone and step for us as a province. I think it's a further indication that we're moving closer to the end of this. But I see, and we've been saying from the very beginning, that we remain in need of caution, because we can't make the false declaration that this is over and that it isn't. I mean, we see flare-ups in other parts of the world, and that has usually meant that has been an indicator of what we could potentially expect here. So I think it's a little bit of both. I think some people will be really, really happy to get rid of the masks. Honestly, I don't particularly love them, to be honest. But I think, like all Islanders, we've been doing our part. I look forward maybe to not being able to wear it all the time, but I will certainly have it as I do here, and we'll continue to have it for a while. But yeah.
I agree. I think it's certainly a sign that we are easing out of easing up on public health measures, and I think this is a really good example of that. And also, it's a sign that we are vaccinating more people with a really important layer of protection. So, and that our epidemiology allows us to happen. So, I think overall it's a positive announcement, but we're continuing to do. It doesn't change all our other public health measures, but I think it's an important one.
Thank you.
Thank you, Mike.
Steve Bruce, CBC.
Yes, hello to you both. Happy Friday. I'm wondering if you can talk a little more about the decision now to stop testing Atlantic Canadians with a PEI pass. How much of that is based on an assessment of the risks and feeling comfortable after all those negative tests that you've had come back, versus trying to speed things up at the border and to expedite that screening process?
Hi. I mean, do you want me to start?
Why don't you? Yeah, sure.
I mean, I think, I think we've tried to outline some of that in the notes that we said right from the beginning that we would have our testing strategy evolve as the summer went on, and that and we should base that, and it should evolve as we base it on the epidemiology. And we know that people who are vaccinated have a decreased level of decreased risk of getting sick with COVID, and also decreased risk of transmitting it. So we have people with a PI pass, meaning that they are vaccinated. We have, so that is already decreasing the risk. We have done testing of 25,000 people at our points of entry, the majority of that, of course, at the bridge, but also on Wood Islands and at the airport. We are also looking at the risk in terms of the numbers of active cases in the region, and so that has come down even faster than we had anticipated when we were planning this weeks ago. So it is really about risk, and of course, there's always process issues in trying to make sure that we don't want people to wait at the points of entry. But I know it's got the people who are working at the points of entry have already made all sorts of adjustments and in terms of who they were testing, who they're testing right now, to make sure it's as easy as possible for people to get through. So it's really more about the risk than about just responding to concerns about people waiting. But of course, that is a good thing too. That if this means that people with PI pass who are traveling from within Atlantic Canada don't require testing, then that will even increase that flow. They will still be stopped and screened, but they won't have that delay of being tested.
And Steve, I would only add that I would never say that we aren't mindful of the fact that we have impediments at our borders, and that is never our intention, and we look forward to the day when we don't. But not once during this pandemic have we allowed that to be the driver of these decisions. I think the fact we have tested over 25,000 people with no positives, I think would probably give us the greatest level of comfort to make a decision like this, perhaps that we've had since the beginning, to be quite honest. This is a pretty healthy sample of testing, and so that gives us the comfort to do this today. And from the beginning, this has been a health response to a public health emergency, which we remain in. And that's why we're able to do this today, because the health factors are allowing us to do it.
And as we get to July 18th and you do open up to more people here, do you feel as though you have enough staff and resources at the borders to handle the increased traffic and to avoid big backlogs? Do you have any concerns there, or is there anything being done to get ready for that increased traffic?
Well, I mean, I think the answer is I am comfortable with the number of staff and with increased traffic from outside Atlantic Canada. Of course, because people are applying for PI passes and indicating a date of travel, we have a good sense of the numbers that are coming in, on a weekly basis. So that is actually helpful, and so I actually think it's a really positive thing. And then this kind of adjustment this week will only help as well as we focus on those who are from international destinations, testing those from outside Atlantic Canada, and those who are traveling within Atlantic Canada who do not have a PEI pass and who are not vaccinated.
If I could just add, Steve, that I think I would echo Dr. Morrison's level of comfort. I think the staff have been the true heroes of this, and I think what we see at our points of entry, particularly in Borden Carleton, are impressive. There's a gentleman up there leading this named Ryan Neal, who is, I think Dr. Morrison would agree, is if you're looking to put the crown on a COVID champion here in Prince Edward Island, that his head would deserve to wear it as much as anybody's. And the way they've been able to adapt under his leadership there, the common sense, the efficiency they've been able to build in there has really allowed a relatively free flow of traffic at our points of entry, particularly in Borden Carleton. And I think with the Atlantic travel not requiring testing if you have a PEI pass, that's still 35 or 40% of our tourism travel. So that will be officially moving along just through a screening process a little bit easier. So I think we feel comfortable with where we're at, and we have a level of comfort because Ryan Neal and so many others are on the job every day making it easy. So.
Okay, thanks so much. Enjoy your weekend.
Natasha Pace, CTV. Thank you. Dr. Morrison, a lot of people may hear the announcement today about the mandatory masks no longer being mandatory in closed indoor spaces and perhaps be worried that lifting this order could ignite a spike of new cases. What do you say to provide comfort to people who may be feeling this way?
Well, I mean, I think we would anticipate some concern from some people who are either visiting or island residents. And I think we need to look at, we have one active case. We have very few active cases in the Atlantic region. We are screening everyone on entry. We are making sure that people who do not have a vaccine have to isolate when they come from within the region. And certainly that will continue to be the case from people outside, coming from outside the Atlantic region. Now they are isolating and will continue to be tested. So I think there are a number of those factors which certainly go into making us more comfortable with changing the requirement from mandatory and removing that order at this time.
Thank you. I also wanted to check, to date, have there been any cases of the Delta variant confirmed in PEI?
Yes, there has been a case confirmed of the Delta variant. That was one of the cases earlier in June.
Thank you.
Thank you.
Gabrielle Drummond, Radio-Canada.
Good afternoon to you both. Ma question c'est en français, bien évidemment, pour la doctoresse de Morrison. Alors, vous avez annoncé aujourd'hui que le port du masque n'est plus obligatoire, mais est fortement recommandé pour certains ancillaires. Et vous avez dit aussi que certaines personnes pourraient être encore plus préoccupées maintenant parce que soit elles ont des problèmes de santé, soit elles n'ont pas encore reçu leur deuxième dose du vaccin. Alors, ma question, c'est pourquoi prendre cette décision maintenant si ça peut causer du stress c'est chez certaines personnes parce que seulement 30% des ancillaires ont reçu les 2 doses jusqu'à maintenant.
Bonjour Gabrielle. Alors, ce changement pour les masques d'aller, comme vous avez mentionné, obligatoire jusqu'à recommandé, à ce moment, c'est à cause de l'épidémiologie ici à l'île du Prince-Édouard et dans la région atlantique. on sait que chaque semaine, on a de plus en plus d'insulaires qui sont vaccinés avec les 2 vaccins. Et puis, l'île du Prince-Édouard était une des dernières provinces pour en faire les masques obligatoires. Et puis, et à ce moment, c'est vraiment retourné où on était l'été passé. C'était recommandé. Et puis, c'est vraiment une transition pour que les insulaires fassent des décisions pour eux-mêmes de protéger eux-mêmes et puis mais aussi les autres. Et puis c'est vraiment dépendant sur leur propre santé, les 2 vaccins, et puis même l'environnement. Si on sont quelque part où ils ne connaissent pas les autres personnes, c'est encore recommandé d'en porter une masque.
Mhm. Et pour les gens qui sont peut-être plus craintifs de laisser le masque de côté, alors quels sont vos mots pour rassurer ces gens-là qui hésitent peut-être, qui ne savent pas encore, est-ce qu'ils vont garder le masque, est-ce qu'ils vont laisser le masque de côté?
Vous voulez, je ne sais pas si je comprends vraiment la question, mais c'est vraiment s'ils ne savent pas, ils ne sont pas confortables. C'est vraiment ce qu'on est en train de discuter, que tout le monde va avoir leur propre niveau de confort, s'ils sont plus confortables ou non de porter ou d'enlever leur masque. Et puis, ça, c'est vraiment dépendant à leur propre décision. Et puis, s'ils sont vaccinés, s'ils ne connaissent pas la santé des autres autour de eux. Alors, j'imagine qu'on va avoir beaucoup de questions. Et c'est vraiment pour un bout de temps, jusqu'à un moment qu'on sait que tout le monde est vraiment plus protégé avec les 2 vaccins. Alors, j'imagine qu'il y a encore plein d'insulaires qui vont porter leur masque quand même quand ils vont aux épiceries. Et puis, même mon mari, j'imagine, m'a dit qu'il faisait ça n'importe quoi, même si on fait les masques pas obligatoires. Alors, ça va dépendre et puis c'est pas, on veut pas que les autres jugent si fait un jugement si vous portez le masque ou non.
OK, c'est bon. Merci beaucoup. Bonne journée.
Bonne journée.
Thank you. I believe that brings an end to our questions. I would just say, as we part, that over the last 17 and a half months or so, we've been here making a lot of these decisions, and we know and we recognize that when we make these decisions, that they bring with them a certain amount of trepidation for islanders. And in particular, as Dr. Morrison noted, as we make our way out of this, there seems to be a little bit more trepidation sometimes with the decisions. But from the beginning, we have followed the same process. It's been health driven. It's been based on the best information and public health data that we have. And when we're at a time now where we're able to make these decisions based on that information, and we only hope we can continue to move forward. But as we've seen throughout COVID, if we need to make decisions to go the other way, and health demands that, health factors demand that, then we would do that as well. But I would say to all islanders, just get out and enjoy this lovely island summer. Looks like the weekend will be better than we originally thought weather-wise, and the summer's just starting, and let's get out and enjoy it. So thank you, Dr. Morrison.
Thank
you,
you.
everybody.